Welcome back to Weekly Neurology Deep Dive, the place to be to stay up to date on all the latest in neurology research. Just a quick reminder before we get started that this deep dive is for educational purposes only and should not be taken as medical advice. We're going to be looking at a recent study giving you a quick overview, but to really get the full picture, you'll want to check out the full paper yourself. This week, we are going in-depth on a 9-year study on the long-term effects of Ocrelizumab in patients with early relapsing multiple sclerosis.
This new analysis really adds to what we know about ocrelizumab, building on the OPERA-I and II trials that initially compared ocrelizumab with interferon beta-1a over 96 weeks. What makes this analysis really interesting is that it looks at a specific group of patients from those trials, those with early relapsing MS who were treatment naive, meaning they hadn't received any prior disease-modifying therapies. And then these patients went on to a 7-year open-label extension phase where everyone received ocrelizumab. So we're looking at a full 9 years of data.
9 years is incredible. It really gives us a look at the long-term impact of Ocrelizumab on disease progression. Can you tell us a little bit about the patients in this study?
Absolutely. The study had 757 patients, with 382 initially on interferon and 375 on ocrelizumab.
Yeah.
And amazingly, 66.7% of them completed the whole 9 years. That's a really high number of patients staying in the study, which just shows how strong this study is and gives us a lot of information to work with on the long-term benefits and risks of ocrelizumab treatment.
Let's get into some of those outcomes. First up, NIGA status. No evidence of disease activity. This is a combined measure of how well a treatment is working to control disease activity.
Well, at the end of the first 2 years, the double-blind period, we saw a huge difference in how many patients achieved NIDA-3, which considers relapses, disability, and new MRI activity. A full 72.5% of those on ocrelizumab had NIDA-3, compared to only 43.8% in the interferon group. And this difference continued even after 7 years in the open-label extension, where everyone was on ocrelizumab by year 9. 48.2% of those who started on ocrelizumab still had NIDA-3, while only 25.7% of those initially on interferon got there.
It sounds like that really supports the idea of early intervention with a high-efficacy DMT like Ocrelizumab. Like getting the disease under control early could have a big impact on disease activity even years later.
That's the takeaway, yes. Waiting to start treatment with a really effective therapy could mean irreversible damage and worse outcomes down the road. The study really highlights the importance of being proactive and managing the disease in the early stages of relapsing MS route.
That leads right into another really important aspect of managing MS, and that's disability progression. The study looked at 24-week confirmed disability progression, or CDP, how the disease is impacting the patient's ability to do everyday things. What did they find there?
The results are pretty impressive over the full 9 years. 78.7% of the patients who started on ocrelizumab had NO 24-week CDP. The patients on interferon did improve after they switched to ocrelizumab in the open-label extension, but they never quite caught up to the group that had been on ocrelizumab from the beginning. This really highlights those long-term benefits of starting early with a high-efficacy DMT. The early control of inflammation and disease activity could really help patients maintain their neurological function and potentially have a better quality of life.
This study also took a look at brain volume loss, which is a key marker of how MS is progressing. What do they see there?
The researchers did find a trend towards more brain volume loss over those 9 years in the group that started on ocrelizumab later. Now, this difference was not statistically significant, p-value of 0.09, but it is something we need to pay attention to and investigate further. Brain volume loss is a big deal in MS because it can lead to cognitive decline and other neurological problems.
The study also looked at annualized relapse rates, which is important when looking at how well a disease-modifying therapy is working.
This data is pretty amazing. The group that started on ocrelizumab had an annualized relapse rate of 0.05. That means about 1 relapse every 20 years. That's just remarkable. The interferon group had a rate of 0.09, which shows just how much better ocrelizumab is at preventing relapses, which can obviously have a huge impact on disease activity and the patient's quality of life.
Those relapse rates are really impressive. Now, the study also looked at neurofilament light chain, or NFL, which is a biomarker for nerve cell damage.
Yes, NFL is becoming an increasingly important biomarker in MS research. It's a protein found in nerve cells, and when the cells are damaged, this NFL is released into the cerebrospinal fluid and blood. If we see high levels of NFL, it could mean that there is ongoing damage to nerve cells, so it might be a useful tool to track disease activity and how a patient is responding to treatment.
What did the study find about NFL levels in these patients?
The patients in the Ocrelizumab group had a significant decrease in their NFL levels, actually getting down to the range we see in healthy individuals by the end of that initial 2-year period. This drop in NFL was much bigger than what we saw in the interferon group, and it really gives us biological evidence that ocrelizumab is neuroprotective. That means it may not just stop the disease activity we can see, but also protect the nerve cells from damage.
That's really encouraging, and it adds to all the other evidence we have to support the use of ocrelizumab in early relapsing MS grip.
Absolutely. This study gives us really valuable insights into the long-term benefits of ocrelizumab, and it should really change how we think about managing early relapsing MS in the clinic.
Now, of course, when we're talking about long-term treatment, safety has to be a top priority. What did this 9-year analysis tell us about the safety of ocrelizumab?
I'm happy to say that there were no new safety signals during this long follow-up. Infection rates, which are always something we watch out for with ocrelizumab, stayed low and steady over the 9 years. And serious infections were rare and usually resolved without any lasting problems.
That's great to hear. It's good to know that the long-term safety profile of ocrelizumab is in line with what we've seen in the past.
Of course, we still need to monitor patients carefully for any side effects, but this 9-year data does give us some good reassurance about the long-term safety of ocrelizumab.
Before we go on to talk about how this all applies to everyday practice, we should mention any limitations of this study.
Well, one limitation is that there's a chance of assessment bias in the open label phase. After that initial 2-year double-blind period, both the patients and the researchers knew who was getting what treatment. Without that blinding, there's a chance it could have affected how they assessed disease activity and progression.
That's a good point, and it means we have to be a bit careful when we're looking at the data from that open-label extension phase.
Exactly. While that open label phase is useful for seeing long-term outcomes, we have to keep in mind that it wasn't blinded, which could bias the results.
So all in all, this deep dive into the 9-year ocrelizumab data really supports its use in early-stage relapsing MS. It seems like starting early with ocrelizumab can lead to lasting disease control, less disability progression, and possibly even neuroprotective effects. And all this while still having a good safety profile over the long term.
I agree. This study provides strong evidence that early and aggressive treatment with ocrelizumab can really make a difference for patients with relapsing MS, giving them a better chance at a future with fewer relapses, less disability, and better preservation of their neurological function.
This is a landmark study that could really change how we approach managing early relapsing MS. So let's talk about what these findings mean for neurologists out there in their daily practice. How will this data affect how they make treatment decisions and talk to their patients?
That's the key question here. This study focused on early treatment-naive relapsing MS, but it makes us wonder about how we should manage patients who are already on other disease-modifying therapies. Should we be thinking about switching patients to ocrelizumab if they're not doing well on their current treatment? How do we balance the benefits of earlier, more aggressive treatment with the possible risks and costs? This study really challenges us to rethink that old wait-and-see approach to MS treatment, where we start with less effective therapies and only change things up when we have to. What we're seeing here is that starting earlier with a highly effective DMT like ocrelizumab may be the better way to go to really manage the disease in the long term.
So it's a real shift in how we approach MS care, moving towards proactively changing the course of the disease instead of just dealing with symptoms as they come up.
Exactly. It's all about preventing or minimizing that irreversible damage as early as possible, which hopefully leads to better outcomes for patients down the line. And the study gives us some pretty strong evidence to support doing that.
So for neurologists in their practice, it's about talking to newly diagnosed patients about the possibility of starting with a high-efficacy DMT like ocrelizumab, explaining the reasoning behind it and weighing the potential benefits against any risks or side effects.
And it's important to be clear that even though ocrelizumab is very effective, it's not a cure for MS. There's still so much we don't know about this disease and how to best manage it over the long term.
And the safety data from this study is encouraging, but we still have to be vigilant and monitor for any adverse events. Infections, for example, are always a concern with therapies that affect the immune system.
Absolutely. Choosing the right patients for this treatment is critical. We need to consider individual risk factors for infection, like age, other health conditions, and their history of infections. And of course, it's crucial to educate patients about reporting any signs of infection right away.
So being proactive about monitoring and managing any potential side effects could really help keep patients safe while maximizing the benefits of the treatment.
This study has given us a lot of valuable data that can help us in our practice. It's worth revisiting some of the key findings and how they can be applied to patient care. For example, that annualized relapse rate of 0.05 in the Ocrelizumab first group, that's just remarkable. It really highlights how powerful this drug is in stopping relapses, which, as we know, can be really disruptive to a patient's life.
Absolutely. When you reduce the frequency and severity of relapses, it can have a ripple effect on the patient's overall well-being, improving their physical health, how they feel emotionally, and their ability to go about their daily life and maintain social connections.
And though it wasn't statistically significant, the study also showed a potential protective effect of Ocrelizumab on brain volume loss.
That's an important point because, as we mentioned earlier, brain volume loss is a concern because it can lead to problems like cognitive decline. So even a trend toward preserving brain volume is good news and suggests that early intervention could have a positive impact on long-term brain health.
And the NFL data is also worth highlighting. The significant drop in NFL levels in the ocrelizumab group suggests that it might have neuroprotective effects actually slowing down or even preventing damage to the nerve cells.
So it's not just about managing symptoms, it's about actively protecting the nervous system, which is really exciting for the future of MS treatment.
This 9-year study gives us a real glimpse into the potential of this shift in how we think about MS care. It pushes us to rethink our approach, prioritize early intervention, and embrace personalized medicine to get the best outcomes for each individual patient.
The findings are compelling, but they also bring up new questions. For example, how do we apply this data to patients who are already on other disease-modifying therapies?
That's an essential question. This study was all about treatment-naive patients, but it does make us wonder if switching to ocrelizumab could be a good option for patients who aren't doing well on their current treatment.
And that's where clinical judgment and shared decision-making becomes so important. We have to carefully weigh the potential benefits of switching to a high-efficacy DMT like Ocrelizumab against the potential downsides, the risks, the inconvenience for the patient, and the cost. And of course, we always have to consider the patient's preferences and individual circumstances.
This study gives us important data to guide those conversations, but it really reinforces the need for personalized medicine in MS. There's no one-size-fits-all solution here.
Exactly. Each treatment decision has to be tailored to the individual patient, taking into account their disease activity, what treatments they've had before, their lifestyle, and their own personal goals.
This study has without a doubt advanced what we know about ocrelizumab and its long-term effects in relapsing MS. The insights we've gained can inform our practice and empower us to provide more effective and personalized care for our patients.
We've really covered a lot of ground today, going through the key findings of this 9-year study and what it means for managing early relapsing MS. Now let's broaden our perspective a bit and talk about the bigger picture of MS research and what the future might hold for disease-modifying therapies. So we've been talking about ocrelizumab specifically, but this study really highlights just how much progress we've made in MS treatment in recent decades. I mean, we now have a whole arsenal of disease-modifying therapies that can actually change the course of the disease.
It really is an incredible time to be involved in MS care. The treatment landscape is just completely different from what it used to be when we had very few options. Now we can offer patients so many different therapies, each with its own way of working, its own level of effectiveness, and its own safety profile.
And while it's great to have so many choices, it can also be a bit overwhelming for neurologists, right? How do you even begin to choose the best therapy for each patient with all these options available?
Well, that's where personalized medicine becomes so important. We have to move away from that one-size-fits-all thinking and really tailor the treatment to the specific needs and circumstances of each patient.
So it's not just about their disease characteristics, like how active it is or how it's progressing, but also things like their lifestyle, their preferences, and how well they might tolerate potential side effects.
And shared decision-making is key here. We need to be having open and honest conversations with our patients about the risks and benefits of each treatment option, giving them the power to be a part of their own care.
This study also reminds us of how important it is to keep doing research on MS. Even with all the progress we've made, there's still so much we don't know about this disease and how to best manage it over the long haul.
Absolutely. In the future, I think we'll see research focusing on finding even better therapies, really getting a handle on the disease mechanisms, and figuring out how to develop personalized treatment strategies based on biomarkers that can help us predict how a patient will respond.
And ultimately, the dream is to find a way to achieve lasting remission, or even a cure for MS bend. But until we get there, we keep working towards better treatments, better quality of life for our patients, and a deeper understanding of this complex and challenging disease.
This 9-year study on Ocrelizumab really shows us what research can do to move MS care forward. The things we've learned from it can guide us in our practice and inspire us to keep pushing the boundaries of what's possible for our patients.
It's been such an insightful discussion. Thank you so much for sharing your expertise with us. And to all our listeners out there, we encourage you to read the full research paper to get a complete understanding of what the study found and what it means for you. We hope this deep dive has given you some useful information to take back to your practice. Keep those brains engaged, keep those questions coming, and join us next week for another deep dive into the latest in neurology research. Until then, stay curious and keep exploring the fascinating world of neurology.